The fine print, our chief medical correspondent, Dr. Narula, decodes what's on the label of over-the-counter medications. And this morning, we're looking at common indigestion medications. Dr. Narula, it's great to see you.
Great to
Just
see
in
you.
time for 4th of July, we were saying, and all the burgers we're about to eat, getting ready for, what we need to look at with these over-the-counter medications. Can we start with the antacids? Because these are so popular, but what does the fine print actually say?
Yeah, this is the perfect segment for today. So you may want to take a couple of these brightly colored little antacids for later. Antacids are very commonly used. They are chewable or liquid forms. They neutralize the acid in the stomach, and they're really meant for short-term, very fast relief of mild heartburn. So think things like Tums or Maalox or Mylanta. In terms of risk long-term with using these, it depends on how much you're taking and how often, but many of them are based with calcium, aluminum, or magnesium. So that can affect the levels of calcium or magnesium or phosphate or even sodium in your blood if you take them long-term, constipation, diarrhea, and can actually affect the absorption of other medications that you might be taking. In addition, if you're taking them chronically and you stop, it can cause a rebound acid reflux. So not so great to use this for long term.
And I think a lot of people get some of these brands mixed up, right? So another one we want to talk about, these H2 blockers. What are they? What do we need to know?
Correct. So this is another common form of medicine. This works a little bit better than the antacids because it actually prevents the production of acid. So think things like Pepcid, Tagamet. These are meant to be used for more mild heartburn or even acid reflux or even ulcers. So stronger situations than you would use the antacids for. In general, in terms of side effects or problems with these long-term, you think about absorption of medications as well. These are broken down in the liver, so they may affect other medicines that are processed by the liver. You can actually also get problems with vitamin deficiencies as well with these. And so again, this is something you'd want to talk to your doctor about if you have any underlying issues that might affect using H2 blockers long-term. And these you can develop tolerance with as well. So if you use them for a long time, they may become less effective over time.
And another one that millions of people take, these proton pump inhibitors, or PPIs.
Right, PPIs.
What's in the fine print here? Because I think this is something that people definitely take when they don't need to sometimes, right?
Yeah, this is a medicine that I see a lot of people end up with after they've come out of the hospital and they just stay on them chronically. But these are really the most potent acid reducers and they have the most prolonged effect. So think things like Nexium, Prilosec, Prevacid. They also prevent the production of acid in the stomach. And so they're used for more significant acid reflux, esophagitis, or even ulcer treatment. And yes, as you mentioned, really they're meant to be used for less than 8 weeks. If you actually use them for longer than 6 months, you should be tapered off of them. And so some concerns that come with this, again, those absorption of vitamins, so you can end up with problems with calcium, vitamin D, iron absorption, gastrointestinal infections. They can actually cause bone fractures with, so things like spine, hip, and wrist if you're on them long term. And they can affect other medicines, so HIV meds, antifungals, and one big class is blood thinners. A lot of my patients are on Plavix, for example. So if you take omeprazole or esomeprazole, that can affect the Plavix. One other important point, a lot of people don't know when to take them. You should take them 30 to 60 minutes before breakfast.